already dealt. So this would be just a revision part on your part. The method of determining the personal identity, like the third party, the subjective and the objective method. Today we have to deal with the objective method. The third party, if you remember, I'll just run the slide, we have already dealt with in the first lecture. And you know what the third party is, usually the relative or the friend of the examinee. Okay, so this will skip and we'll move on. Subjective method also we have dealt. So moving on, we'll straight away come to the objective method of, here the utilization of morphological and belongings data is analyzed. And if you remember, we had touched this topic also, that the objective method is usually used whenever we have problems and we get a decomposed body or a fragmentary remains or mutilated body. Here the problem arises where you have to identify by certain things like we divide this into biological and non-biological belongings. The biological belongings being the things which resist putrefaction, such as the hair, the nails, the bones, and the fluids such as the semen and the other body fluids like the CSF, the blood, the urine, and all that part. And the non-biological thing consists of the belongings, the personal belongings of the individual, like the clothings or the articles, like we said, the CNIC number, if we are lucky enough to get it, or the wristwatch or any ring by means of which you can at least identify, okay, this ring or this wristwatch belong to so-and-so person. So this is usually to maintain the chain of evidence. Now, today's topic, osteometry. Osteometry has been successfully used in the estimation of stature, age, sex, and race. And these are the four parameters, the age, sex, race, and stature, which are considered as the big fours of forensic anthropology. And how we do, first of all, index for race determination. If all those who have taken my first lecture, we have touched this, how we determine the race through the mathematical calculations or the indices. So this would be a revision for them, but those of you who do not know, we'll start with that. And we told you that race could be determined very easily by seeing the cephalic index or the cranial index or the breadth index. All three names are for the same thing, and they are seen in the skull. Okay, so this is very important. Sometimes it is asked in the BCQ, what is the cephalic index used for? So it is to detect the cephalic index, the mathematical calculation done on the skull. And how it is calculated? It is the maximum breadth of the skull measured transversely and divided by the maximum anterior-posterior length multiplied by 100. This also I told you the maximum breadth was the maximum breadth transversely across the skull taken just above the mastoid process, okay, and maximum anterior-posterior length from the glabella in front to the occipital protuberance at the back. This is how you take, and this, mind you, is taken by the help of calipers. This cannot be done by straight away by means of measuring tape, okay? So this has to be calculated by calipers. This is the thing, it is shown in the photograph, how the breadth is taken, transverse breadth from just above the mastoid to the other mastoid, the maximum transverse diameter, how it is taken. But this is usually shown on the live person. The person is alive, but usually when we are taking it, it's on the skull and of a dead body. Then according to that, we divide it into 3 or 4 categories, and the one by means of which we get the result, we can just place it into category of dolichocephalic or the long-headed. This also we have done, so this is somewhat like a revision for you all. A skull can be termed as dolichocephalic or long-headed when the cephalic index ranges between 70 and 74.9. And the examples of this is the Negroes or the Aborigines. The Negroes usually, we do not call them Negroes, black or whatever you call them, and the Aborigines. The mesocephalic or the medium or the long-headed is a skull when the cephalic index ranges between 75 to 79.9. An example are the Europeans. We Pakistanis also fall into this category, and the Chinese. So the brachycephalic or the round-handed when the cephalic index is 80 to 84.9. An example are the Mongols. Okay. Then there's another category by term of super brachycephalic when the cephalic index is 85 or more. And usually these are the people who fall into the category of imbeciles. The main example of this is the Apert syndrome, in which the genetic abnormality and there are large number of skin manifestations, or those people who are of low IQ and they have a genetic abnormality. So they fall into a super brachycephalic, where the cephalic index is 85 or more. This table will give you an idea of what we have just dealt with. This is just a table so that if you people just can go through and memorize it, it would be very easy for you. The same thing that we have discussed, it has been tabulated form, now given in a tabulated form. So this I'll hold on for a second so that you can see, you can take screenshot, whatever, and then you can, at the time of your exam, you can, it will be very easy for you to memorize these figures, okay? Then this is the diagrammatic representation, the dolichocephalic, the long-headed one, you can see the length. Then you can see the middle one, the mesocephalic, which is somewhat in between the two, and the brachycephalic, which is somewhat rounded in shape. This is also a diagrammatic representation. This, on the skull, they have shown that how the long-headed one, the negroid, you can see it is the example of the dolichocephalic. The Caucasoid, which the Pakistani is falling into it. This is somewhat in the middle, in between the two. And then the Mongoloid, which is somewhat rounded in shape. So on the skull also, you can see the differentiation if all three are placed together at the same time. Then comes the long bone indices for determination of it. One more thing which I have to add is, and it is not on the slide, is that while determining the race, you also see two more indices, that is the nasal index and the height index. The nasal index can be calculated by seeing the width of the nasal aperture divided by the height of the nasal aperture into 100. That's how you calculate the nasal index, okay? While the height index can be calculated by the height of the skull divided by the length of the skull into 100. Also, you people, whenever you take my lecture, please have a copy or a pad, whatever, and a pencil or pen, so you can jot down any additional things which I tell you and which is not on the slide, because I'll be telling you from the exam point of view, from the PCQ point of view, from the Viva point of view. So this you can note, because everything is not given in the slide. So again, moving on, the nasal index and the height index, which also determines the race, okay? And this is very important indices, but the most important being the one we discussed, that is the cephalic index or the breath index or the cranial index. So out of all these, that one is the most important, but others can be nasal index or the height index. Then you can see by the shape of the orbits and the nasal opening in the palate. This also we showed you in the previous slide that I took the lecture the first day, that the blacks, they have orbits which are rectangular in shape, the Europeans triangular, and the Mongoloids which are rounded in shape. The nasal opening is also broad in black. In Europeans, it is narrow, and in Mongoloids, again, it is rounded. The palate, again, is rectangular shape in black, Europeans somewhat triangular, and Mongoloids horseshoe-shaped shape. So these are some of the indices of healing. Then the indices of the long bones may help in identifying by means of the brachial index, which is also known as the radiohumeral index. We'll do this one by one. Intermembral index or the humerofemoral index. Crural index or the tibiofemoral index. All these you have to, it's just a memorization of things, and you have to remember what the particular index is used for to determine race or sex or whatever it is used for. This is again in a tabulated form, so you can very easily take a screenshot and it will be helpful to you in remembering that the brachial index is again calculated by taking the length of the radius divided by the length of the humerus into 100. For Europeans, it is 74.5, Negroes 78.5. The crural index taken by the length of the tibia, the length of the femur divided by it and into multiplied by 100. For Indians, 86.5, Negroes 86.2, Europeans 83.3. So you can see the slight difference that there is in each and every indices that we are dealing with. The humerofemoral index is calculated by taking the length of the humerus divided by the length of the femur into 100. For Europeans, it is 69, and for Negroes, it is 72.4. And for Caucasians, I think it is not calculated to that extent, or the data might not be calculated, so that it's not given here. The intermembral index calculated by the length of the humerus divided by the plus the radius, and length of the humerus plus radius, okay, divided by the length of the femur plus tibia into 100. For Europeans, again, it is greater than 70, and for Negroes, it is less than 70.5. So hopefully you have taken this screenshot and you're able to remember at that time of the exam. Then long bone indices for determination of sex. Okay, this also very easy. It is given to you in a tabulated form, so you can, at the time, you can very easily memorize it, remember it. The one thing is the ischiopubic index. This is a very important index, and it is also known by the name of Washburn index. So sometimes in the BCQ you get confused. We give you by the name of Washburn and you say, okay, this is not being done. We have only learned ischiopubic. So this is one and the same. The Washburn and the ischiopubic index are one and the same. And how you calculate it? By taking the length of the pubis divided by the length of the ischium into 100. Males, it comes to about ranging from 70 to 73 to 94, female roughly 91 to 115. Then this sciatic notch index, this is also a very important index, and this is usually even calculated when we have a dead infant with us, and this gives a very accurate estimation to us. And this also is one of the most important indices where we calculate when we have to determine the sex. Okay, so ischiopubic and sciatic notch index are two very important indices. Sciatic notch index is the width of the sciatic notch divided by the depth of the sciatic notch into 100, which just comes to be about 4 to 5 in males and 5 to 6 range in female. Sternal index is also one of the important criteria, not the most important, but one of the important criteria, the sternal index, where it is calculated by the length of the manubrium divided by the length of the body of the sternum into 100. 46.2 is the result in male, 54.3 in female. The corporobasal index calculated by the breadth of the body of the first sacral vertebra divided by the breadth of the base of the sacrum into 100. It is greater than 42 in males and less than 42 in female. Last, the sacral index. This is termed as the transverse diameter of the base of the sacrum divided by the interior length of the sacrum into 100. The range comes into less than 114 in males, and in females it is greater than 140. One more thing, which is again not given here, is the Ashley's rule of 149. Now, what is Ashley's rule of 149? It is the combined midline length of the manubrium and the body of the sternum. Okay, again I'll repeat. Ashley's rule of 149 is the combined midline length of the manubrium and the body. If it is greater than 145 millimeters, it is termed as a male. And if the combined midline length of the manubrium and the body comes to be less than 149 millimeters, usually it is a female. So this is known by the name of Ashley's rule of 149, done in the sternum, okay, to determine the sex of the person. Okay. Then again, this is the Kelotic index. Okay, then what is Kelotic index? This is somewhat confusing. I have a diagrammatic representation in the next slide. So first I'll just read what is Kelotic index, and then you can see it better on the diagrammatic representation, what it says. It is used to identify the sex of human skeletal remains. Okay, when you get a skeleton and you have to identify out of the remains of a human skeleton, you apply this Kelotic index, and it is how it is we get it by the sacral part of the Kelotic line divided by the pelvic part of the Kelotic line into 100. Now, what is the Kelotic line? Anthropometric line extending from the posterior aspect of the iliopectineal eminence to the closest point on the anterior auricular margin. I'll have the next slide for you. So you can see just above where it is written 6 and 7, just above the line running above it. Okay, that you can appreciate, and you can see how it goes, how it turns and how it goes first towards the ilium and then towards the sacrum. This is how this line is the measurement. And then again, I'll read the definition so you can well appreciate what it is. Okay, so this is the line extending from the posterior aspect of the iliopectineal eminence. This I've showed you just above 6-7 point, and then to the iliac crest, the sacral portion. And because the pelvic segment is predominant in female and the sacral segment is predominant in male, So the Kelotic index may be used in forensic practice to identify the sex of human skeletal remains. Although in the end, you can see it suggests its reliability is limited because it's very, very difficult. I'll again show you the diagrammatic representation that even if you get a pelvis, then it's very difficult to measure it along these lines. You have to make the measurements. And here the forensic experts are not that trained enough to measure it. Outside also it is being done. But again, the reliability, like we said, is of limited value. But it is an index, so again we have to use it wherever possible, and we have to know what it is used for. Okay. Now comes the topic of, okay, one more thing again, which is not on the slide, and again, it's, you can just jot down the figures that I'm telling you. In the femur, if you have to detect the sex mathematically, then what you see is the vertical diameter, okay, the vertical diameter of the femoral head. The vertical diameter of the femoral head. If it is more than 47 millimeters, you can say it is a male. If it is less than 45, it is a female. Okay, the vertical diameter of the femoral head, okay, in the femur to determine the sex. Again, for the sex in the femur, you see the bicondylar width. It is more than 78. It is most certainly a male. If the figure comes to be less than 74 millimeter, most certainly female. Also in the humerus, you see the vertical diameter of the humeral head. If it comes to be more than 45.5 millimeter, you can say it is a male. If it is less than 41.5 millimeter, it is a female. So this is also somewhat a rough calculation by means of which you can determine the sex, where if you get a skeletal remain, okay, or if you get a bone. Now, anthropometry. Okay, what is anthropometry? Some student, I think in the first lecture, asked what is the Bertillon system. So I told him that in the coming lecture, we'll be discussing this in detail. So that's why I skipped it in the previous lecture. Now, what is anthropometry? This system is adopted chiefly for habitual criminals. Okay, this is specifically for habitual criminals, not done routinely. There are two systems by which this is carried out. One is the Bertillon system or the Bertillonage. Number two is the Galton system or the Galtonage or the dactylography. This also we'll be doing in detail. Besides, there are other systems of identification by the name of Leucard's system or poroscopy or the portrait Parley system. Okay, these are the four methods by means of which we detect. So moving on to the first, the Bertillon system of Bertillonage. This you can see is named after its inventor, M. Alphonse Bertillon, who was an assistant in the criminal investigation department in France. And according to him, he said that there are certain measurements which are taken, measurement of the various parts of the body. And he said that these measurements do not alter after the age of 21 years of age. That is, that after 21 years of age, all measurements, they become fixed or constant. And if we take the measurements of the different parts of the body, then they will be individualistic for a person, and the measurements are also not going to change. Okay, the ratio in the size of different parts to one another, although it varies considerably in different individuals. So that's how he said one individual could be distinguished from the other individual. So it has three parts, this system. One, by means you take the descriptive data. Descriptive data means you take the color of the iris, the hair, complexion, the shape of the nose, chin, ears, and the photograph of the full face and the right profile. In that you take the descriptive data. Number two, you record all the body marks. Example are if a person has moles or birthmarks, scars, tattoo marks, you have to record that if present. Third is the body measurements. In standing and in sitting height, you have to take the measurements. You have to take the length and width of the head, the length and width of the right ear, the length of the left middle and the left little finger, length of the left forearm and the hand, the length of the left foot, the size of the feet, the toes, the span of the outstretched hand, okay? And all these information, they are about, some books say there are 11 criteria which you have to take. Some say you have to take 14. So there's a slight variation ranging from 11 to 14. You have to take these measurements that we have just talked to you about in detail. And this information is recorded on cards and kept in specially arranged cabinets. And only measurements still made now, because of the disadvantages or the drawbacks that we have with this arrangement. Because one thing, the disadvantage being that it is applicable to persons above 21 years of age. So what if you get a person below 21? You cannot apply the system to that. Then you require very trained manpower and instrument. Also, it is very time consuming. It is a very lengthy procedure. So obviously the chances of fallacies are greater. And it also, nowadays, that's why this is now replaced by the fingerprint system, which is far more superior to this. And the only measurement which are still made as a routine now are the height and the weight. That is the only two things which we still take, the height and the weight. Otherwise, the rest of the things we skip. And this is just a matter of, for your knowledge, that this system was being introduced and it was taken. But although, the one who invented it, he said the odds against any two persons having the same measurements is in the ratio of 1:286. So it was that specific. But as you can see, the procedure, it is such a tedious, time-consuming, fallacies and all that, that now is not being used. So, okay. So this was the Bertillon system or the Bertillon age. An easier method to know the height of the person, when only if you get just one bone is available to you, as in cases of mutilated bodies, is by use of the osteometric boards. This osteometric boards, you have to remember that whenever you have to measure the length of any long bone or any other irregular bone also, usually the long bone is taken, the osteometric board is used. It is a special board by means of which you place it in between it and you see the measure it. And they are given, the markings are given on the sides by means of which you can specifically measure the length of the bone. Okay, so osteometric board is used. All the bones are drawn according to their anatomical position by placing the bone in the anatomical position and measuring the length. You measure the length and then you multiply it with a factor which is known as the multiplication factor. And this multiplication factor is a specific. It is a constant factor which is constant for every bone. We'll give you the constant factor also the next slide, that it remains constant for every bone. Okay, it is specific for individual bones. So we get height of the skeleton. When you get this, to this you have to add 1 to 1.5 inches given for soft tissues of the scalp and the sole. You have to give that measurement because you are measuring this length in a skeleton, in a bone, which is skeleton, which is obviously a skeleton. So you have to add 1 to 1.5 inches for the soft tissue of the scalp and the sole, which will give the exact height of the person. Okay, moving on, these are the multiplication factors of some important bones. Humerus, constant 5.3, radius 6.3, ulna 6, femur 3.6, tibia 4.2, fibula 4.4, and clavicle 11.2. So how you calculate, for example, if you get one femur is found, let's say its length is about 20 inches. So 20 multiplied by, what's the constant factor for femur? You can see on the slide, 3.6. This will give you approximately 72 inches or 6 feet. 6 feet, to this 6 feet, obviously, like we said, add 1 inch for the soft tissues and the soles, and you get 6 feet 1 inches, which would be the exact height of the person. Like we said, 1 inch is added for the soft tissues of the scalp and the sole. So this is how you measure that. Roughly, if you get a bone, you could say that this was the height of the person when he was alive. Okay. Then comes the Galtonate system or the dactylography of fingerprints. This is also a very important method of detecting the, like we said, the how to determine who the individual is or was. It is done in the living as well as in the dead. This is obviously the surest method of identification based on the principle that there are papillary ridges present on the balls of the fingertips, and individual peculiarities of the pattern are absolutely constant and persist throughout life, from infancy to old age. This and no two persons resemble each other. Even the fingerprints of two monozygotic twins is not similar. So even this is even more than that which we see in the DNA profiling, because there also the even in twins you can get a similar finding. In monozygotic twins you can get a similar finding, but here in the Galtonage or the dactylography method of fingerprinting, even the monozygotic twins they do not have the same similar fingerprints. This method was devised by Edmund. Okay, the Edmund Locard was a poroscopy one. Okay, so like we said, and the advantages. First, we'll do the advantages. What are the advantages of these methods? Like we said, it is the surest sign of identification because the prints are present since birth and they remain constant till death. Even they are present in the intrauterine life. While you are in the intrauterine life, the prints can be detected. Okay, so this is that much, you can say it is reliable. Until they remain permanent, till the hands are totally destroyed. If, for example, you don't get the hand at all. So obviously, and this fingerprints are present on the epidermis as well as the dermis. So even if, for example, the epidermis thing, the outermost layer is lost by some means, you can still get the result from the dermis. Even like we say in the decomposed body or the putrefied body or the mutilated body, even if the, or in cases of drowning or in cases of burn, if the person has died because of burn injuries and decomposed body, what you can see in the decomposed body, the skin easily peels off and you get the degloving of the skin you get. Even from the degloved skin, you can just place it in 10% formalin so that it dries up a little and hardens, and then you can easily take the prints. And like we said, even in the body which is immersed in water, you take it out, you dry it, and then you harden it by formalin and you can get the result. Even if like we said, the epidermis is off, you can get the result from the dermis. So it is that reliable. The habitual criminals usually have a habit of, they rub sandpaper. If they see, okay, you call some criminal for identification, he has done some any measures he has taken so that he may not be identified by rubbing sandpaper or adding acids or corrosives to the body. Then also you can take it after some time. It takes some time for the ridges to reappear or to regenerate, but after a few days you can do so. So you can know that he's trying to hide his identity by using these measures, and you can easily, after a few days, you can again apprehend him and you can take the fingerprints because of that. So they use these foul plays and all that. So the other advantages of, obviously, the either he's a normal person or a person who is a habitual criminal, you can individualize the person. Okay, let's see so and so. In this procedure, no special instruments or trained person is required for taking prints because only the magnifying lens is needed, and we see how the procedure takes place, and you can see it by means of just a magnifying lens. Records can be kept easily for comparison at any time. The prints can be faxed from one place to another throughout the world. Now there is a database by the name of AFIS, capital AFIS, which means Automated Fingerprint Identification System. Through this, it permits rapid entry, comparison, and identification in just minutes to hours as compared to weeks or months, which was used in the conventional manual search methods. So this method is now being used and data is collected. The only thing, like we said, needs simple training, simple magnifying glass for the recognition, classification, and matching. And computerization of the record is very easy. So this is the main advantages of taking. Now, how you take this? The method consists of taking impression of the bulbs of the finger and the thumb with printer's ink on unglazed paper and then examining with a lens. There are two methods taking the fingerprint. One is the plain method and one is the rolled impression. In plain, you just take the printer's ink and you just press your thumb on the printer's ink, and you take an unglazed white paper and you just dab or press lightly, gently on the ink surface by the tip of the finger on the paper. That's it. That's how you take the plain impression. The rolled impression is taken by rolling the inked paper, ink finger on the ink pad, and you have to take it between the two nail boundaries. You have to take that much ink that it covers your two nail boundaries of a thumb or a finger. And then you place it on the paper and you just slightly roll it from side to side. Just slightly roll it so you get a rolled impression. This advantage is that you get a greater surface area is covered of your thumb or your finger impression in a rolled impression you get. Okay, so this is a better option that you get. Rolled impression, like I said, covers a large area. It is preferred, while taking the thumb impression, usually the thumb or left thumb in males and the right thumb in females is used. Now, the various patterns that you see in the fingerprints are, there are four main types that you see the pattern, and by means of which you can say to which pattern the individual belongs to, and by means of which you can identify and you can determine his identity. They are the arches, but they cover just the 5% people have their pattern pertaining to arches. Loops is the most common and the most commonly found in all individuals. Here it is written as 60, but I would say ranges between 60 and 70% of the people, they have these loop patterns found when you get the prints. Then the whorls. Here the slide is you have to see there's a slight mistake in that. The whorl pattern is 35%. It is written in front of the composite, but this is wrong. The whorls compose 35% of the people, they have the whorls pattern. And the composite or compound, only 1% of the people, they are belonging to the composite, they have this pattern, you can say, composite or compound. The arches. Now, in the arches, like we said, the first one, the arches, the 5% people belonging, the ridges, they run from one side to the other without making a back turn. This is a very interesting thing, because when we used to when we had the interactive sessions in the classroom also, we used to tell everyone, okay, I used to bring a hand lens with me, and I used to say, okay, check out what pattern you have. And if people wanted the hand lens, they could do so with the magnifying lens, and they can even detect themselves to which pattern they belong to. And then we used to have a sort of a practical done that on the glazed paper, we had that thing, the thumb impression or on the paper, so everyone could know what pattern their thumb belonged to or could be categorized to. So in the loop pattern or the pocket formation, the ridges, they either sway towards the thumb or the little finger. Okay, they are ridges either swaying towards the thumb, going towards the thumb or the little finger side. If the loops, which have a downward slope towards the thumb side, from the little finger, running from the finger towards the thumb finger, then they are known as the radial loops. And hello? What's now? Okay, मुझे 10 मिनट दीजिएगा, 10 मिनट. अच्छा. And if they are known as the radial loop, the loops which have a downward slope towards the little finger are known as the ulnar loops. The whorl pattern, when the ridges run in a circular form around the central core, an ideal whorl consists of three things, which is a central core, intersecting ridges, and two deltas. These are the whorl pattern. Two deltas which fall in the same straight plane. How delta is formed? It is formed when a single ridge, it bifurcates, or there are two ridges running and there is an abrupt divergence side by side. I wish I could have shown you diagrammatically, but you have to remember, a recurrent whorl is one which makes a circle in one direction and then in the opposite direction. Compound or composite means all the above three patterns, arches, loops, whorls, are found mixed in the same impression. Then what is the Locard system of poroscopy? It is devised by Mr. Edmund Locard, and the principle being that the sweat glands, which are the opening pores of the finger ridges, they present in the finger and the palms are studded with pores, which are mouths of the sweat gland ducts. The pores, they vary in size, shape, position, and number. They usually vary at the number of 9 to 18 pores per millimeter. The number of pores are there. And this is useful when only a small fragment of a finger or a palm is available. Then you use the poroscopy method to detect the fingerprints. Okay. These are type of fingerprint. Fingerprint development was, like we said, the finger, palm, and the hand and soles of the feet of the humans bear friction ridge. These are the dermal cravings on the tip of finger. A number of basic patterns are seen. The ridges, like I told you, first time they appear at the 12th to 16th week of intrauterine life, and the formation gets completed by 24th week of intrauterine life. And then from then onward, they remain constant throughout the embryonic life, birth, and the life of the individual. Factors which are responsible for the distinct patterns are the genetic and the fetal movement, friction, and all that. Now, loss of fingerprint. Temporary loss of fingerprints can occur, may be seen when there's swelling of the fingers, when stung by a bee, but returns when the swelling recedes. Then the permanent impairment of the fingerprint. Pathologically, injury should involve at least 1 to 2 millimeter skin area beneath the skin surface, so that you can have a permanent impairment of fingerprints. Okay, permanent impairment is because of leprosy, electrical injury, post-radiation exposure, dermatitis. Now, one thing a little bit different, there is sometimes a temporary loss in eczema, psoriasis, acanthosis, nigrans, celiac disease, scleroderma, and dry and atrophic skin. There is a variation. There is a temporary variation in the size and pattern in the below 4. The permanent variation occurs usually in leprosy, electrical injury, and post-radiation exposure dermatitis, the above 3. Okay. Then criminal deliberate permanent, I told you, erasure by criminals to reduce the chance of conviction can be achieved by burns, acid, and plastic surgery, but this is just a temporary arrangement. Pharmacologically, by anti-cancer drugs used, they can have an adverse effect of treatment with a drug called capecitabine, and you can have a sort of a eraser of the fingerprints. Profession, the stone crushers, they have this. Then there's a portrait parley system of identification. In this system, the front view and the side view of the photographs of the faces of all international criminals are supplied to all international airports and seaports, so that a suspected criminal may not escape from the suspected country. Okay, this is also a system which is used for criminals usually. Footprints, impression of a foot or shoes left on the ground at the site of crime may be helped in identifying the criminal. At the time of birth, usually you have seen in some countries, the footprint of the newborn is taken so as to prevent exchange of children and kept in records. In most of the countries, footprints of the Air Force personnel are taken because in air crashes, the body is mutilated and foot is often preserved because of the long and thick boots. In a dead body, the fingers can be rounded out and smoothened for taking prints by injecting. Okay, if you get a decomposed or mutilated body or a dried or mummified body where the skin is dry, then how can you smoothen it and you can take the fingerprint? By subcutaneous injection of glycerine or melted paraffin, or soaking the fingers for a little time in an alkaline solution. Prints can be obtained from the dermis if, like I said, the epidermis is lost by histological section up to a depth of 0.6 millimeter from the finger pad surface. Types of prints are the plastic prints. These are fingerprints on the soft surfaces such as soap, wax, wet paint, or the chalks. They are likely to be 3-dimensional plastic prints. Those on the hard surface are either patent, patent means visible, or latent, which means invisible prints, which can hardly be seen. Visible or patent are usually formed when blood, dirt, ink, paint is transferred from a finger or thumb to a surface. Patent prints can be found on a wide variety of surfaces such as smooth, rough surface, porous surface such as paper, cloth, wood, or a non-porous surface such as metal, glass, or plastic. Latent prints, like I said, they are obscure, they are hardly seen. They are formed when the body's natural oils and sweat on the skin are deposited onto another surface. They are not readily visible, like I told you. Detection requires use of fingerprint powders. There are specific dusting powders that you get. Then there are chemical reagents like silver nitrate or ninhydrin or iodine. These are alternate light sources by means of which you make the print visible. The smoother and less porous surfaces, the greater the potential that any latent prints present can be found and developed. These are the means of the dusting powders that you use. Then last is the superimposition. By means of superimposition, it means a technique which is applied to determine whether the skull is that of the deceased person. It is a technique where you take what you do is that you have a photograph taken when the person was living. You enlarge it to that of the size of the X-ray, which you take in the postmortem. Okay. Then the two things, the positive of the photograph, which is enlarged to that of the X-ray, and the negative of the X-ray are placed one on top of the other. And the superimposed. This technique was first applied by Gliston brush Ruxton case. Now, I've told everyone that in the net you have to search what the Ruxton case is, and then you can see it was a case in 1930s where this method was applied to find out the criminal, the person who was involved in the crime. And this is a very interesting case which you can see in the net. You can search for it. The technique used for this is skull photo superimposition. Then there is the frontal sinus identification through direct superimposition, mostly using 2D posterior anterior X-rays. And this is how you get the negative of the X-rays. The skull photo superimposition, technologically, the skull photo superimposition have passed through 3 phases. Either there is just the photograph superimposition where you take the photograph and you enlarge it and you place the negative. Then you can have by a video, where your video is taken, one of the skull and one of the photograph and intermingled, and then you see the image, or the computer assisted where you digitalize it, and by means of digital method, the superimposition techniques can be applied. The photograph, again, a facial photographer discovered unknown skull is used for facial reconstruction. The antemortem, like I said, photograph is enlarged to life size and made transparent. The skull is adjusted in such a way that the inclination and orientation are the same as that of the head in the photograph. Complete skull is required to obtain the positive identification. This is important. The anatomical landmarks which are compared for a positive match, they will include the external auditory meatus, the orbits, the anterior nasal spine, the chin point, the angles of the mandible, then the zygomatic processes. All these have to match. The negative and the positive, like you see in the photograph, they are superimposed on each other. And if all these factors that we have discussed, they match with each other on the same angle, being on the same level and the same angle, then we can say that the superimposition technique by means of which we can identify the individual. One more thing, the experts say that apart from the positive identification, this is more towards the negative identification. That means that its importance is more towards the negative, that if negatively you can say that this does not match, then they will have greater importance in the court of law rather than positive, because positive you have to be an expert and you have to measure the exact measurements you have to do, then only you can exonerate a person or you can charge him with a crime or so on. So it is in your hands, this thing, to prove or disprove. Okay. This is how this is done. This is how this is done. Facial recognition and reconstruction, we say. Computer superimposition we have done by digital means by using a video computer with appropriate software and then compare the 2 images morphologically by image processing. Okay, this is how it is done. The half and half side is given to you and shown. Trace evidence is just a small part. Trace evidence refers to the physical evidence that is found in small but measurable amounts, such as you find the strands of hair, fibers, or the skin cells on the scene of crime, and by means of which you can locate that, okay, this is the person or this is the thing. In cases of sexual assault, it is very important because in this transfer of biological materials such as semen, blood, saliva, hair occurs from one to the other. So this trace evidence is of importance where it is applicable in cases of sexual assault and other things. Okay, where you can locate the assailant to the victim or the victim to the assailant. From the assailant and the victim both to the scene of the crime. Non-biological material from the scene of crime to both assailant and the victim. Okay. Classification of trace evidence, again, biological evidence, non-biological evidence. The biological evidence originates from human, animal, or plant source and include mainly body fluids, body tissues, stains, okay? And other biological materials, human hair from the head and the pubes, scrapings from the undersurface of the nails, which contains epithelium of skin of assailant or victim deposited during physical or sexual assault, okay? Non-biological, again, items of personal use and found in the environment, foreign bodies and all. Okay. These personal items are clothes, spectacles, purse, wristwatch, or other things in use. Okay, or the environmental materials are fibers from carpet, vegetation in the garden, grit particles from the road. Okay. Trace evidence is based on the principle known as, this is very important because this is known as the Locard's exchange principle. Whenever you have to do Locard's principle, exchange principle says that whenever one things come in contact with the other, there is always a transfer of material from one thing to the other. Okay, this is Locard's exchange principle, and it is Locard's. I can just tell you, okay, this was a director of the first crime scene, not important. But the other thing is importance is the Locard gave two principles. Every contact leaves a trace, one, and exchange of trace is usually a two-way process. Okay, so this was it. This is Locard's principle. Okay, and this is it. So I'm done with this part 3 of the personal identity. If you have any questions regarding, you can ask. So
हेलो साकिब हो गया चैट अगर है तो करें वरना हो गया बाबू वो आप वो शेयर करेंगे चैट का हम करेंगे चैट पे चैट पे करें
कैमरा ऑप्शन
जी ओके Is subjective method used only for identifying living individual? Is objective only used for dead individual? Okay. You know, subjective method, like I said, was a determination through the morphological data, the physical aspects. Okay. So that's how you can see in a living. You can see also in the dead. But the objective method, usually, it is more beneficial, obviously, if you have to get, like I said, from the hair. Okay, hair you can get even in the living, like I said, the living and all. But usually, if the objective data involves the mathematical statistics, what we dealt with, or the mathematical indices, or like we said, if it is more beneficial, where we get just the skeleton or the fragmentary remains or the decomposed body. So there, mainly the objective method of identification is used. Like I said, we will discuss today that if you just get a bone, how will you identify a person? Okay. So like I said, the objective is more beneficial if you get a decomposed or mutilated body or fragmentary remain, while subjective other aspects of that can be utilized in both. Okay, please repeat the part, what? On the diameters of the femoral head and the humeral head. Okay, the femoral, or the, like I said, you have to memorize it because it's not given in the book. So I'll just repeat it. On the femur, if you have to determine the sex, the vertical diameter of the femoral head, if it is more than 47 millimeter, it's a male. If it is less than 45 millimeter, female. Okay. Again, in the femur, you see the bicondylar width. If it is more than 78 meter, it is most certainly a male, you can say. If it is less than 74 millimeter, most certainly female. While in humerus, if we see the vertical diameter of the humeral head, if it is more than 45.5 millimeter, male. If it is less than 41.5 millimeter, it's a female. Okay. Please repeat the part. Okay, I've done that. I've taken that question. So hopefully you would have written it down on paper or whatever. So any more questions? Because the time is up. And we have a fourth part coming up on Friday. So if you have any questions regarding out of all these three parts, you can just say so and we'll go, because I think the fourth part is not that extensive. So hopefully in the end, we'll be taking up the questions as well. May I end the class? Yes, please. Please, Sakib, I'm done. Okay. Thank you all. Thank you all for attending.